Today we're going to be going over the procedure for our venous Viva. First, we're going to start with preparation. Have rubbing alcohol, gloves, a new tip for the Viva, and 2 to 3 towels in the hot towel cabinet. Check the time. A full treatment is no longer than 45 minutes. Now we're going to cleanse. Remove any makeup using the micellar rosewater makeup remover. Cleanse the skin using IS Clinical or the Purifying and Balancing Facial Cleanser for 2 to 3 minutes and remove with a warm towel. Now we're going to numb. Apply a nickel-sized portion of numbing cream to the client's skin. Do not rub too much and make sure it spreads evenly onto the skin. Wait 20 minutes and then remove the numbing cream with a warm, soft cloth. Apply alcohol with a cotton round to the face. Avoid getting too close to the eye area. You may use a fan to dry the skin for the client's comfort. On the Viva applicator, take off the dummy tip and put on a new Viva tip. Check the Fitzpatrick skin type chart for the settings. Base your settings on the client's main concerns and follow the protocol sheet on the machine for the Viva settings. Perform a test spot on the side of the neck. Watch the test spot for 60 seconds to see how the skin reacts. Lower the settings if you see excessive redness or swelling. You do not want to see the imprint of the Viva tip on the skin. You may increase the next treatment parameter by 10% on following treatments. If treating an Asian client, there is a specific setting to use and do not overlap. You can treat Asian clients on a half pattern if you are worried about causing any adverse reactions. Perform Viva in a horizontal pattern. Make sure to only overlap by 50% and that all pins are in full contact with the skin. Do not leave spaces in between and do not overlap the same spot twice. If you're unsure if you hit a spot, then skip the spot to prevent burning the client. The pattern should be done to stay in sequence to not lose track of where you already hit. Constantly check to make sure you are not lifting the gun before it's done and there is full contact at all times. Check your pattern so there are no mistakes. Be consistent and careful. Under the eye, you can go up to the lash line as long as you can pull the skin down onto the orbital bone. As long as you can pull up onto the orbital bone, you can also go under the eyebrow or the actual eyebrow if it's not tattooed. Once finished with the Viva treatment, take off your used tip and immediately throw it away in the sharps container. Wipe the handpiece and cord down with alcohol. Do not apply any products on the client's skin. Now for an add-on, you can use the Soluma. Place goggles on your client. Turn on the Soluma Pro LED. Set the Soluma Pro LED to aches and pains and keep it on the client until their treatment time is complete.